Hi there, Tracy from Kazadan's Equestrian, and welcome to this week's video where I do the next part of my lameness series, but in particular we're looking at horses that tend to trip over. So most horses have tripped or stumbled at one time or another. This is in itself is not an unusual thing. However, if your horse is a regular tripper or it's increased in frequency, then it may be time to stop writing that tripping off as the horse being lazy, etc., and start investigating underlying causes. There really are many reasons that a horse can trip, not the least of which can be rider error when we try to manage their head and neck so much they can't even balance themselves. But I do hear a lot of people making excuses for their horse tripping, saying that they're lazy, they're not putting their feet up, they're not concentrating, etc., etc. Really all reasons that don't seem like a thing for a natural athletic horse to do. And there are many, many underlying causes of which tripping is a symptom. So if we continually just write off that tripping as your horse being lazy, you're missing one of the first signs that you get that means you can identify a problem going on earlier to increase the prognosis for your horse if there is an underlying causal issue. So even if your horse only trips occasionally, it really can be worth, at the very least, looking at these three major causes and having a look at your horse, conducting a lameness examination and seeing if you can identify why your horse may be tripping. Faltering or tripping normally occurs at breakover, and by breakover I mean the normal part of a horse's stride where the weight-bearing phase is ended, the hoof rolls over and the limb is protracted and brought back. That is breakover. And there are many reasons that breakover can be inhibited, and we're talking pain of the weight, pain of flexion, etc., etc., and any restriction of this extension and flexion movement will predispose a horse to tripping. So what are the main reasons that a horse could be tripping for? There really are three main categories that I'm going to look at. The first one is the premature breakover. The next one is the decreased proprioception. And the third one is an unwillingness or an inability to reach the correct stride height. So let's go back to the breakover issue, where a horse may tend to lift its own foot itself and not allow the natural hoof rollover or breakover to occur. They lift it themselves and break the natural flow of the stride. Anything that causes this to occur will predispose the horse to tripping. One of the main reasons this occurs is excessive toe length. Now this should be really easy to remedy, but it's still seen a lot. With a lack of heel or a long toe, the horse is put into a position where it's very hard to get the leverage to break over properly. So to avoid putting that strain on themselves, they simply lift the foot in the air prior to that. And that really does predispose them to tripping. So number one thing to look at is your hoof trim to start with. If that all looks okay, but you can see that your horse is lifting before the proper breakover, another reason can be tension and pain around those very important structures in the lower part of the leg. So the tendons, the ligaments that are very involved in that breakover and the movement of extension and flexion. You will see the horse try to mitigate that by lifting the foot early. The other spot a horse can get pain, which will make them want to lift the foot early again, is in the navicular coffin bone region. So any pain there, the horse is going to want to lift that foot earlier rather than to roll it over. And again, this fits in this category of premature breakover. And if your horse is doing that, then it could really be signifying that there is some joint problems in the navicular region, the coffin bones, all those structures around the soft tissue structures around the lower part of the leg. Okay, the second category is decreased proprioception. If you don't know what proprioception is, well, one, I have a video on it, so go and have a look at that. But it really is an awareness of your body part in space and time. If you want to get a feeling of what this is, then stand up where you are, close your eyes, and just randomly step your foot or do a backwards lunge. This feels a little bit uncomfortable, but if you get yourself used to it, it feels less uncomfortable. That is your proprioception. So there are a couple of main reasons a horse would have decreased proprioception. The first one is recovering from an injury. So you can have your vet scan or x-ray a joint, scan a tendon or ligament and tell you it's 100% recovered. But if you haven't focused on proprioception in that recovery, then your horse has lost the ability to really understand where that limb is in space and time, and will absolutely increase the risk of redoing the same injury by tripping, falling, or placing the foot wrong. The second very important reason for a horse to not have that sensory input, the decreased proprioception, is actually a neurological disease. As you can imagine, this is very important to identify quickly and early to get treatment and diagnosis from the vet. So the third category is the unwillingness or inability for your horse to reach its proper stride height. One of the common reasons for this is joint pain, fetlock, stifle, shoulder, elbow, foot, etc. If a horse has got joint pain, then they will minimize the flexion or bend of a particular joint. This is why in pre-purchase exams, vets will do flexion tests. But if a horse doesn't want to bend, flex those joints to their maximum, then they're not going to get the height of stride. So the horses that you see maybe dragging their feet a bit, some reason not lifting that leg, one of the reasons can be joint pain. If a horse is sore in the muscle, so it's got a tear or a strain or something, makes it very hard for them to protract the limb. So again, you will not get that stride height. If the muscle is sore, a horse can just choose to not engage that muscle, and that is going to again see a little bit of a dragging motion and a lack of musculature protraction of that limb, and again lower stride height than you would like to see or is normal for that horse. As well as a sore muscle and a horse disengaging it due to pain, you also can have a horse that is very weak in muscle. That is going to give you a very, very similar result here. They're not able to lift it enough to get the proper stride height. Sometimes old injuries can provide some scarring, which inhibits muscle movement as well. So sometimes that interference can also stop the horse protracting or lifting, bending that limb as much as it should. And one of the other reasons is physical interference of any of those mechanisms in the stay apparatus of the horse. In particular, we see this in the stifle, but any kind of physical interference that stops or causes discomfort or physically stops a horse moving a particular joint will stop your horse being able to protract the limb and put maximum flexion in and get the stride height that it needs to minimize the risk of tripping. So they're the three main categories. This gives you an idea of some of the reasons that horses do trip and why it is so very important to not just assume your horse is lazy. This is your first symptom of trying to catch some of these issues early. And if you do, like I say, we prolong the ridden career of your horse and increase the chances of a really good prognosis with early intervention and early care. I hope you've enjoyed this video and you found it very useful. If so, please share it around as much as you can. That's really great for me. Don't forget to subscribe to the channel. Click like and comment on the YouTube video as well. That's terrific. And click that notification bell so that you get notified when I release my video next week. Thanks for listening, and I'll speak to you then.